Hello, this is a tertiary approach to sexual health. I'm Sarah Stanton, the clinical director for NC Start East.
And I'm Taylor White, clinical team lead.
The NC Start East team identified many systems that were encountering difficulty accessing appropriate supports regarding sexual health for individuals with IDD-MH. A contributing factor to that was the cultural influences in Eastern North Carolina. The history of sexual health access and treatment in individuals with IDD in Eastern North Carolina has many negative influences, including a pervasive history of forced asexualization and sterilization, which remained in place for over 60 years. North Carolina was the third highest state in the nation of individuals sterilized throughout that time period, with around 70% of those individuals having IDD. Additionally, North Carolina currently ranks as the 10th most religious state in the country, which has influences regarding openness to sexual health dialogues overall. These cultural influences impacted individuals who are currently active for START services in Eastern North Carolina. And the START team identified this as an area for additional training needs as well as linkage.
Using the tertiary care model, we use the following methods. For primary, trainings to community providers, MCOs. Secondary, conducting a clinical education team on sexual health and case-specific provider education. And in tertiary, case-specific consultation, crisis engagement, and individual-specified education. We evaluated the outcomes of the tertiary care interventions via case-specific qualitative responses, as well as participant evaluation of our community trainings, including applicability and satisfaction. One specific case example was of a female in her early 30s. She is currently diagnosed with borderline personality disorder, post-traumatic stress disorder, and a mild intellectual disability, as well as obesity and hypertension. She has an extensive trauma history to include many instances of sexual abuse and exploitations that has influenced her to seek unsafe and healthy relationships with strangers. Through our tertiary care interventions, her system has begun to understand her sexual health wants and needs and are learning how to help her achieve them safely.
Our vision for the future includes continuing to increase capacity of our communities by targeting tertiary interventions across all 3 A's, which includes continuation of the interventions that we've already started. Thank you.